And now I'm going to do some oscillations here as well. So I'm just kind of giving him some wiggles. I have my other hand kind of resting on here to try to give him some reassurance. People always ask me, students and things, why do you put your other hand on the person's arm? Are you feeling for anything? I do feel for like some guarding and stuff. But a lot of times, I've got two hands, and I was taught, if you have two hands, use them. So it is kind of more the laying of the hands, just trying to impart a little bit of energy back to Eric, that I have some compassion for what he's got going on here. Eric and I are big believers of mind-body awareness, of being in a peaceful place. You can do that. Big believer in prayer, and working on meditation and guided imagery and all these things. Very important for a person to have a sense of trust and a sense of peace about this, because it is a very painful procedure to have done. You hear horror stories about how painful shoulder therapy is and how bad rehab can be. So me as a therapist, I need to recognize that and do things to help my patient be as comfortable as they can, but yet still do my job, which is try to get some range of motion in this arm. So obviously, he gets some pain there. I'm going to talk a little bit more from a technical standpoint right now when we're doing range of motion on somebody this early on. There's a couple things we look at, and it's called a pain resistance assessment or pain resistance scale. And what that means is when I move somebody passively, when do they feel their pain? Do they feel it somewhere here in mid-range where I'm not really feeling any stopping point? Or do they feel it when I get close to a stopping point, which Eric kind of does? Or do they feel it when I get to, a hard stopping point? That really dictates, how much I can push a person. If they're getting pain before I reach any kind of barrier, I know that they're highly inflamed and I need to use more modalities. I need to ask them about their pain medication, their coping strategies, things on those lines. Because if I'm getting pain before I even reach the barrier of the range of motion, I can't push through that. That's not going to work. If they're getting pain when I approach the barrier, then I need to impart some of my skills as a therapist, some oscillations, some gentle distraction, maybe some breathing techniques, something like that, to get to where I can get to the barrier. They have pain when I reach the barrier. That's kind of what I'm looking for eventually, so that we can start some stretching. We really don't stretch these people too aggressively here in the beginning, but definitely we want to get some motion done. So through some of those oscillations and some of the laying of the hands and some of the relaxation, Eric's working hard on his breathing right now. I'm actually now able to pick up his arm, which I wasn't able to do a few minutes ago, and now I'm working on some nice abduction. And I'm using my body weight, kind of going in and out. I gotta try to match his rhythm, and he's doing great. Now I do want to get rid of this pillow for a second just so we can see. Some of my patients, this would be the first time that their arm's actually been away from their body. This is actually a good opportunity. I'll sometimes get a washcloth, a warm washcloth, and clean this area. Eric mentioned in his video about the importance of hygiene and not getting any kind of fungal infection or a rash build up in here. That would be a setback for us. And but he's a tough guy, and he's got a great caregiver right now, and he's been able to do some hygiene. So if that was a situation, I would hold the arm here, and I would encourage someone to come in and help clean this area for Eric. We still had a lot of betadine and that kind of stuff on there. I'm going to show you some techniques. You can see how I've got him kind of cradled here. The patient needs to feel reassured that I'm not going to let go of their arm. That's their biggest fear right now. So I'm very conscientious about that when I go to change my hand positions around. I'm going to show you another little technique that I like to use, where I use my leg. And I get my leg up underneath him. Now he feels pretty secure again. That's a little uncomfortable for me. So I'm going to bring him down a little bit. And Eric's doing great. So, you can't rush this kind of stuff. I think this is a really nice technique. This is something that I was taught. I was fortunate to have very good mentors in my career, experts in the field, on some of my internships and through some other professional affiliations. And I've learned a lot of valuable techniques, plus from experience too as well. I've been doing it a long time. So now Eric's doing great. You feel like I got your arm, Eric?
Yeah.
So, you know, I've got him. See you, Tony. And now I'm really getting some nice abduction here. And again, I can impart some manual skills. Just some little layer 1. Release. Get some of these pecs to kind of let go and relax a little bit. Very powerful muscles. Some perpendicular deformation. Really important that you know, you research these kind of things. Talk to your surgeon. You got to feel comfortable with the surgeon. You know, I encourage people to go meet the therapist that might be doing their therapy after their surgery. You got to have a lot of trust and faith when you do an elective procedure like this, that the people that are going to be responsible for your recovery are going to give you the attention that you need and have the skill sets that they need. If not themselves, somebody in the facility that can oversee them